All right, today we're opening a tactical guide to microscopic warfare. Nope, we're not talking about tanks or jets. We're talking about two incredibly powerful weapons in our medical arsenal, fluoroquinolones and sulfonamides. So think of this as your personal field manual for understanding exactly how we fight bacterial infections. Here's our mission briefing for today. First, we'll get the lay of the land, understanding the battlefield, which is bacterial synthesis. Then, we'll get to know our two key weapon systems, the DNA-disrupting fluoroquinolones and the folate-blocking sulfonamides. After that, we'll talk strategy, and we'll wrap up with the rules of engagement, how to use these things safely and effectively. Every good mission starts with understanding the terrain, and in our case, the battlefield is actually inside the bacteria itself. These tiny organisms are basically non-stop construction zones, using these internal assembly lines, we call them synthesis pathways, to build everything they need to survive and multiply. And guess what? That's their biggest weakness. So our core strategy is something called synthesis inhibition. Really, it's a lot like sabotage. Instead of just a head-on attack, we sneak in and we mess with their supply lines and their factories. Think about it. If a bacterium can't build its essential parts, it just can't function. It can't replicate, and the infection gets stopped dead in its tracks. This shows two totally different tactical approaches. Fluoroquinolones, they go right for the command center. They disrupt the synthesis of DNA, which is the bacteria's genetic blueprint. But sulfonamides, on the other hand, they cut off the raw materials by blocking the production of folate, which is a vital nutrient. So two different targets, but the exact same goal in the end. And this leads to a really crucial difference in the outcome. A bactericidal antibiotic? Well, that's like a kill mission. It actively goes in and destroys the bacteria. A bacteriostatic antibiotic is more of a halt production mission. It stops the bacteria from growing and multiplying, which gives your own immune system the leg up it needs to clear out the infection. Okay, let's talk about our first weapon system, the fluoroquinolones. These are our DNA disruptors. They're powerful, they're broad spectrum, and they are bactericidal. These guys don't just stop production, they go in and actively take apart the enemy's ability to replicate at the most fundamental level. So where do we deploy them? Well, their versatility is pretty impressive, and you can remember it with the pure gram mnemonic. They're used for common but serious stuff like pneumonia and urinary tract infections. But they're also pulled out for really specific threats like anthrax and some tough multi-drug resistant organisms. They're absolutely a frontline defense in a lot of scenarios. But here's the catch. Powerful weapons almost always come with the risk of collateral damage. The tendons mnemonic is like a critical safety briefing. The most famous risk, the one you always hear about, is tendinitis. But these drugs can also cause nervous system effects, they can mess with your blood sugar, and they can even affect your heart. Using them means you have to do a really careful risk assessment. And just to really hammer that point home, take a look at this. The risk of a tendon rupture isn't just some abstract idea. It most commonly hits the Achilles tendon. This is a specific, serious side effect that both clinicians and patients absolutely have to be aware of, especially in people who are already at a higher risk. All right, let's pivot to our second weapon system, the sulfonamides. These are our folate blockers. So instead of breaking the machinery, they just starve it. By blocking the production of folate, which is an essential vitamin for bacteria, they basically bring everything to a grinding halt. This is our bacteriostatic, or halt production strategy. So where do we use these folate blockers? Well, the sulfonamic gives us a pretty clear picture. They're a real go-to for common infections like sinusitis and urinary tract infections. And their role as a folic acid antagonist also makes them super important for treating certain opportunistic infections, like pneumocystis pneumonia. Now, just like our other weapons, sulfa drugs have their own set of risks, which we can remember with the sulfon mnemonic. The really big one to watch for is hypersensitivity. Things like skin reactions and hives are common warning signs, but they can also affect the liver and the kidneys. And it kind of makes sense, they can even lead to a folate deficiency in the person taking them. And this is exactly why any rash that shows up while someone's taking a sulfa drug has to be taken very, very seriously. This highlights that what might start as just a simple rash can, in rare cases, escalate to really life-threatening conditions like Stevens-Johnson syndrome. It is a critical warning sign that you just can't ignore. Okay, so we have these two really distinct classes of antibiotics. How on earth do we choose the right one for the job? Well, this gets us into strategy, specifically this idea of spectrum. Are we doing a wide-scale operation, or do we need more of a targeted strike?
So, a broad-spectrum antibiotic, like our fluoroquinolones, is kind of like a carpet bombing run. It's effective against a whole lot of different types of bacteria. A narrow-spectrum antibiotic is more like a sniper. It's designed to take out one very specific enemy. The choice really depends on knowing your target. If you use a broad-spectrum weapon when a narrow one would have worked, you can cause a lot more collateral damage, and that includes driving antibiotic resistance.
And that brings us to our final, and honestly, our most important section, the rules of engagement. I mean, having powerful weapons is one thing, but using them wisely and safely, that's what wins the war without unacceptable costs. These are the best practices for everyone involved, clinicians and patients. For healthcare professionals, it all boils down to a pre-mission checklist. Before you even think about deploying the antibiotic, you have to assess for allergies and get cultures to identify the enemy. Then, during the mission, you are constantly monitoring for side effects and checking on vital systems like the kidneys and liver. This level of vigilance is just non-negotiable. And for the patient, listen, you are a critical part of the team here. So this is your mission briefing. Number 1, you have to complete the full course, even if you start to feel better. That's how we make sure every last enemy is eliminated. Number 2, take your doses on schedule to keep the pressure on. And maybe most importantly, you are the soldier on the front line. You have to be the one to report any unusual activity, a severe rash, bad diarrhea, anything, immediately. Your role is absolutely vital to success. At the end of the day, fluoroquinolones and sulfonamides are incredible tools. They have saved countless lives, but this is an ongoing war. Bacteria are smart. They are constantly adapting, and they are developing resistance to even our best weapons. And that leaves us with a final, really urgent question. Are we using these tools wisely enough to stay ahead of them, or are we just speeding up our arrival into a scary post-antibiotic era?